Hey YouTube, it's your girl Chic from Chic Say What. It's been a long minute since I last came to you all with a video. But as we all know, it's just been a whole lot going on in this world. It's just been a lot. 2020 certainly have gotten off to a whole kind of different start. But before we get started, if you can do me a favor and hit the like button, the subscribe button, the bell, all of that jazz, so you'll know when I do come out to post a video. And please comment, share. But tonight I want to talk about, well, let's just start here. I hadn't recorded in a while because during a time like this, I really didn't know what topic I wanted to capture or tackle. You know how, my videos are. So everyone's been home, quarantine, being with the family, getting to know them in a whole kind of way. I'm sure us, your married people or booed up people know all about that. You seeing all kinds of sides of your partner that you normally don't see. But it just makes for interesting times and definitely memorable times, both good and bad. And, that's why I wanted to, I woke up from a nap and then, usually I listen to something in the background. And today, I wanted to get an update on what's going on with the virus. And I saw a video that was posted by CNN, and basically it had the headline, Black Americans are at a higher risk of COVID. And I guess I find it interesting because it just doesn't seem like it was that long ago when I was out talking to my sister about the whole belief that blacks can't get the virus. We're exempt, we're immune, like we just got it like that, where we don't get it, they get it, that's a them thing. So fast forward to today, now that we're in April, I'm just hearing these stats that are alarming, to say the least. And I just wanted to bring them all, bring this information to you all, just so you can have it for your own information and to share. And I think it'll be a great discussion piece, because sometimes, seeing it in numbers can kind of make a situation more real. Some of us may, since all of this, have learned about a family member, a friend, or someone close to us having it, maybe not necessarily dying. I haven't known anyone who's died from it, but I've definitely known of a family member. Let me just say this. I haven't known of any confirmed cases of that being a cause of death for it. But since all of this, I have lost a family member. I lost my grandmother. She did die due to what we believe is, heart failure. But it was in the midst of all of this, and she was in and out of the hospital. But it's, like I said, it's more of an afterthought of, what really was her cause of death. I think she was maybe 75. But she's not on record. She lived in California. She's not on record as being a death of the virus, but it is something that my family and I have talked about. So with that being said, I have confirmed that a family member has had it, tested positive for it, and they've 70 years old and they have overcome it. So that's a blessing. But I want to just talk about some information that I learned from from a little 10-minute video that I did watch on CNN. And it started out with the U.S. General Jerome, shout out to him. He definitely appears to be a great representative of our community that's just bringing facts to the world of how, things that we need to know. And a lot of this information, we may not necessarily pull it from those press conference with our president, but this is just some general information that he talked about that I think, is informative for us to know. And he's a very smart guy, young guy, but his number one, or I don't know if he necessarily listed his reasons in a number of importance, but he gave kind of two reasons as to why he feel like the Black community is impacted at higher numbers than other communities. And he started out by saying the number one being lower socioeconomic status. Now, let's face it, of course, when you have a lower social economic status, that means you have limited resources. That could also mean that you live in environments where it's a good chance that it may not just be the nuclear family with the mom, the dad, the children. There may be aunts, uncles, grandparents, just friends, other people living in the household, people kind of coming together to just survive. So when you think of that, it would make it more of a challenge to social distance within a home. Also taking into an account the living space could very well be a much smaller living space than maybe that of someone of another culture or ethnic group. So let's just say you have 7 people in a home, but the square footage in that home is maybe under 1,200. So, when you think about it with the social distancing, which is what they're recommending, 4 to 6 feet, what's the likelihood of that happening? So he mentioned that. He also mentioned that when you have that and then you layer that on top of, we're more likely as a African-American community to have diabetes, heart disease, as well as lung disease. So we already have your lower social economic status for, the reasons I just said. And then when you layer that on to health concerns, like where's the money coming from for co-pays, or I know a lot of people who are working people who don't even have medical insurance because they simply cannot afford it. So I don't know if you all heard, I've heard people talk about the working poor. Today being the working poor, whereas you have many of us who do have jobs, but we live paycheck to paycheck and we still feel like we don't have enough. So then when you have a crisis. I feel like we're in crisis mode. I just told my husband today, I feel like we're living in a movie. He was like, well, why do you say that? I'm like, this ain't normal. Like, this is not normal. So it's something like, you sitting at home watching a Netflix with the family. Like, this is so far from normal. Like, just yesterday, my mother had a birthday and she had to celebrate it on her own. She lives by herself, and she had to celebrate on her own because just out of, with the whole social distancing, and then she's constantly watching the news and she's seeing entire families getting wiped out. She's just like, I just can't do it. I just can't do it. So we really don't know, when we'll physically see her. We talk to her, but it's just a different kind of time that we're living in, and it's very tough times. So the stats that they did provide that I want to share, they provided it for 3 states, and I suppose they provided it for these 3 states because this is where blacks are most impacted. But these are the 3 states they provided stats for. So they stated for Illinois, 40% of the deaths have been for people who are part of the African American community. However, they are only 15% of the population. That's a lot. Take that in. Louisiana, 70% of the deaths. However, they're 33% of the population. So they said that's like 7 in 10. The family member that I did learn and have it, he actually is from Louisiana, but he lives in Arkansas right now. So he is in the South. Like I said, he survived, but he has been impacted by it. Then for the state of Michigan, 41% of the death, however, only 14% of the population. That's a lot, y'all. So the question is, do we still believe that we're immune to this? Are we believing this information? I'm on YouTube all day, every day. I don't really watch TV, so even when I'm working, I have YouTube in the background. But I've heard a lot of people who actually still, it's like they're still not believing this. It's like they're, you hear people who say, well, I don't think it's a real thing. I think it's exaggerated. I think maybe people are dying, but they're dying of different things. And they're saying it's from the virus. I'm going to still go out. I'm going to do what I want to do. And then, like I say, I see the next report that gives me numbers like this. So I'm like, okay, what's really going on? Do we have enough of us taking this serious or believing in it? I personally, I do take it serious. I have been in the house. I will say when I do go outside, I am walking in my neighborhood. I'm either by myself or with my husband and kids. But I haven't gotten to the point where I've completely just shut myself in the house. Like, I'm not there yet. A mask, I have one. I haven't started wearing it like 100% of the time when I go outside. But I do. I wore it today, but I started getting hot and I took it off. It's like I'm not there yet to wear it 100%. And the question is, are we there yet? You know, I've heard CDC has recommended that we do. However, I heard the president stand up there and say, I ain't wearing that thing. Y'all can wear it, but I'm not wearing it. So where are we with that? Is it, you know, I heard that, okay, it's more so protecting you from other people, not really other people from you. But now they're like, okay, everybody wear it. So what we doing here? So it's just a lot going on. You know, my kids don't have anything to cover up with, so they, you know, they stayed in the house. Grandma started talking about makeshift masks, so they might be doing a project on that soon. But I just went out today. But it's a lot. I know it's a lot, and I feel like, you know, I always use, you know, the saying whenever someone asks me a question, when the world opened back up, because I feel like the world is just completely shut down, and we just don't know when it's going to open back up. Like, we're taking this thing day by day, and if you're someone like me who watch the news or listen for updates, the numbers aren't moving in our favor. The hope is that with the quarantine that the numbers will eventually go down. But personally, from what I watch, I haven't felt like the country as a whole has been that aggressive with it for us to see that type of impact. Like, say your other countries have, like China or Italy. Like, they went like, listen, we shutting all this down. You should have went to Walmart a week ago. Like, I feel like really in order for us to kind of get to that place to maybe where they are today, we would need to have something like that. But I know it's a lot, and I tell people, like, American culture is, I'm gonna do what I want to do when I would want to do it. And you have a lot of people that are still moving like that, with that mindset of like, you not gonna tell me when I can do something, how I can do it, who I can do it with, what I need to be wearing when I do it. Like, that's something that we're not ready for. And even though we're seeing these numbers the way they are, it's still like as though we're still not there. It's just a lot to take in. And even for myself, it's just a lot to take in. And I just wanted to come to you all to just share the information that I have, because we all have loved ones, and a lot of you out there that will be seeing this will more than likely, you know, look like me. And I heard Van Jones, you know, he just threw it out there. Listen, if you take some type of pill every day, some type of medication, you don't need to be outside. And when he put it that way, it's just like, wow, like, because chances are, whatever, you know, your medication is something pertaining to what General Jerome Adams said when he said, you know, we have high numbers in heart disease, lung disease, diabetes. So you're pretty much taking a medication for all that. And if it's attacking things like, you know, with your respiratory, like, that will take you out. So I see what he's saying about that. There was also a specialist on the program. Her name was Dr. Kamara Phillips Jones. She's a family physician and an epidemiologist. So when I Googled that last word, I learned that it's basically the study of health and disease and its conditions, like the patterns, all of that. So she studies those things. So she talked about, on top of having like the disadvantages that we have that I've mentioned early on, we have active neglect in our community, and a lot of this is because of structural racism. Let's face it, that's just not something that, I think that within the Black community we talk about the racism a lot, but I don't think that it's a discussion that's had a lot with people outside of our community. I know anyone who knows me, and I do communicate with people outside of my, you know, community. You know, I'm quick to point out something if I feel like there's some type of underlying base dealing with race. And more often than not, everything is about race. Everything's about money. Everything's about race. It is what it is. So she talked about, what the social economic status being lower in the Black community. That means that it's more likely for us to have forward facing jobs. And I thought about it and I'm like, okay, yes, you're going to have more of us maybe working in a Walmart, in a warehouse, in fast food, probably driving, what do you call those ride share. You're going to have more of us doing those type of jobs, and those aren't jobs that you can exactly do remotely. When you're in a business environment where you just have a laptop to take home, just think about it. What percentage of us are in those type of situations? And a lot of the Blacks who are, they may make work in a lower level position within that corporation, and that position may not warrant them to be able or give them, what we're going to say, the privilege of having, a laptop to take home. So when you do have those forward facing, you're exposed more naturally for, those jobs. You're going to be exposed more. And because we don't have the protections that we need, as we're always hearing about, like we don't have the gloves, the masks, like the nurses don't even have that, but you have whole news reporters going in, interviewing the nurses and the doctors, and they suited up. And the nurses, I've seen videos with them wearing zip, what do you call that? The hefty bags, the trash bags, because they don't have, the proper gear. So, that becomes a question of, do they have what they need to do their job? I'm seeing all those reports to say no, but then I see reports with our highest leader to say, oh, everybody's good. Everybody got what they need. So which is it? Residential segregation. That's one of the points that the doctor brought up. Environmental hazard segregation. Like, just face it, a lot of the resources that we do have, like, for example, I think when I was just back home recently, when I went back home to California and had to go there for my grandmother's funeral, I was talking to people about schools, and at that time the schools were like shutting down then. And they were talking about not all those schools had access to laptops for the kids to do like digital learning. So, and and some did. It seemed like it wasn't uniformed. So I'm not quite sure the details on the background of how California as a whole is operating when it comes to the schools being shut down. But from conversations that I was having with some family members who kids were in school, or actual family members who were, the students, they were saying, they weren't aware of having, being able to have laptops to work, like do the digital learning. Like that was something new to them. They hadn't done. So they really didn't know what that was going to look like, but they had just gotten word that the schools were shutting down. And this was, I guess I went back home in March. I think it was last month when I went back home. Listen, these days are running together. I had someone send me a text message today, and it said, hey, remember those days when we was little and we wore those underwears that had the days of the week? I think I need me a pack. And that one just took me out, because before I lay down for a little nap, I thought about it. I'm like, okay, what's today? And I looked and it was Tuesday, because I'm like, I don't know what day of the week it is anymore. So when she said that, I just remember, I'm sure, a lot of you Black girls out there, y'all remember them panties. Y'all little, y'all other groups might have worn them too, but I know the Black girls, we had those panties that had the days of the week. But all of these, things that I'm talking about dealing with our health, this all goes into the pre-existing conditions that has already plagued our community. So we already have the pre-existing conditions, and then we got this thrown on top of it. It's just a recipe for disaster, just to say the least. It is. And at the end of the day, it's going to impact far too many people. I mean, family, it's just a lot. I mean, like, my mom keeps me updated on a lot of, like, oh, it's taking out entire families. And the last story she sent me, I think the family was out of Louisiana. It was a mom. I think she was like 85, and her 3 sons, they all died from it. And I think the sons were like 58 through like 70, I don't know, but they were up there in age too, but like all of them died. So it's just like, I've heard of husband and wives it's just a lot. So that alone, you know, when she was considering, you know, visiting, she was like, I just can't do it. It's just, I just can't take that risk. And I am there right now. It's just like, okay, you know, I miss my family. Where anyone who knows me knows that you know, we're always my family. We're close. My family that's here in Georgia, and we get together a lot. And a lot of times it's at my home, but it's just too much going on to where it's just not even the same with trying to invite someone over. So we haven't done that in weeks. Not since I've, you know, I think once since I've been back from California. It's just a lot. So I'll wrap this video up. I didn't want it to be too long, but I felt like it was just information that I needed to share. And I'm hoping that it can spark some conversations within your homes, within your families. You can call your loved ones, share the information with them, talk to them about how they're working through all of this, make some suggestions. I've heard, you know, people talk about, you know, drinking warm drinks as far as with, you know, helping with the throat, because since that's where the virus a lot of times kind of, I guess that's where it kind of stays in, you know, in your throat. So you want to kind of keep that warm drinks during the day. I haven't gotten there yet where I'm doing things like that. I'm always just kind of drinking water, mostly drink water and eat on ice during the day. But that is something that I did here. But what I do, my husband, he's Dr. Taylor. He on Clockwork, we are taking vitamins, vitamin C and vitamin D. So I told him he reminds me like when you in labor and when you at the hospital having a baby and them nurses coming in knocking on the door or waking you up at all weird hours to keep you on the schedule to take your pain meds and you just trying to sleep. Well, that's Mr. Taylor. So we're doing round the clock vitamins and things like that. And I think it's actually helped a lot with my allergies and controlling a cough that I had because of, you know, I feel like it was allergies. So take your vitamins, you know, research that. Vitamins C and D, those are supposed to be good for the immune system, and that may help as well. It's funny, when we went shopping at Costco a couple weeks ago, the guy who was checking us out was like, now this is what everyone needs to be buying. No one's buying this. They still had a lot of vitamins on the shelf, but I'm sorry, we were at Sam's. They didn't have, you know, everyone was buying. He's like, everyone's buying all the chemicals. No one's buying the vitamins. So it was like us buying it, and it was like an Asian lady buying it. Like, so clearly she was hip to the game. So get yourself some vitamins for you and your family. Take some gummy vitamin C vitamins. So everyone in the house take that, and then a vitamin D. So take care of yourselves, everyone. Hopefully it won't be so long before my next video. Like I said, I really didn't know what to talk about because it's like I didn't want to talk about the virus because there's so much information out there about it. But when I heard this information, I'm like, okay, it just got, you know, was put on my spirit to bring this to you all so you guys can have this information, you know, because this is this is the information that they're putting out there. And I believe that it's definitely safer to believe in it versus not. You know, and you have to make that decision for yourself of whether or not you're going to take, you know, this situation serious or not. And what do you have to lose by taking it serious? So, I mean, if you can do little extra things to protect yourself, why not? But, yeah, again, if you can, do me a favor, like, share, subscribe, comment. We're all in the house, so just comment. Let's keep this thing going. Another thing, I've thought about maybe even doing some lives, but I want to see what you guys think about that. So you can let me know that inside of the comments, and that would kind of, you know, allow for us to have some more interaction. I haven't done that before. I wanted to kind of get my subscribers numbers up more before I did that, but I don't know. So since we're all in the house, you know, it might be a good time to do it now. So let me know also if there's anything in particular you'd like to talk about, maybe in a live to make it more interactive. Let me know that as well. So everyone, take care of yourself. Peace and love.